So again, good morning and welcome everyone. As Joyce said, my name is Imani Byers-Quarterman. I'm a licensed clinical social worker as well as a full spectrum doula that has been trained by the National Black Doulas Association in fertility, birth, and postpartum. And I'm here today to talk to you about how to get paid through TRICARE, through the childbirth services demonstration program, how to get paid through TRICARE as a doula. I will give a few disclaimers as we go through this process today. And as Joyce said, we want to make sure that we facilitate a space where you can get the knowledge that you need. And then I will also, I have handouts that I sent to the MBDA team that they'll be sending out to you all as well to help you with this process. Okay. So any questions, please feel free to put them in the chat. Up until we get to the question and answer part, I promise that I will do my best to answer what I can. So just wanted to give a few disclaimers here. This is a depiction of what I can and cannot do, okay? So I am not personally affiliated with TRICARE as a representative. I'm a doula and clinical social worker, so I'm in the field just like you all, who has also been successful in filing claims with TRICARE East. So TRICARE East is processed through Humana. I do not file the same way that TRICARE West does, but I do have a resource for individuals who are in TRICARE West to get some more intentional support. So more to come on that as we go through the session today. Okay. I'm also able to provide you with some preliminary knowledge and resources to support your success in being able to file these claims. And any questions about missing claims or platform troubleshooting, you will need to follow up with your TRICARE rep directly once assigned. So if you are already in the TRICARE network, you should have been assigned a rep, especially if you completed the participation agreement, and more on that as we go through as well. But if not, that will come once you've gone through the application process. So we're going to walk through this from top to bottom. So from applying to making sure that you're credentialed to then submitting a claim. Okay. So again, as questions come up, please put them in the chat and we'll be sure to moderate them at the end. All right. So again, just a little bit more about me. I'm currently based in the state of Georgia. As I mentioned, I'm certified in fertility, birth, and postpartum through the National Black Doulas Association. I am also at LCSW, perinatal mental health certified, and I'm also an instructor here with the NBDA. I'm a licensed instructor teaching fertility, birth, and postpartum. And I've been doing doula work since 2020. I've been a therapist since 2018. But since 2020, I've supported over 150 births here in Georgia. So just some housekeeping guidelines to ensure we are encouraging productive engagement. Please make sure to check your microphone, as Joyce said, to ensure you are on mute. Of course, we don't want any disruptions because, of course, things can happen. So please make sure that you are on mute and you'll in the answer section. We'll want a skills overview. I'm gonna give a demonstration and then guided practice. So if you are already in the TRICARE Humana platform, please feel free to follow along once we get to that portion. And then of course, utilize the chat and we'll answer the questions during the last 15 minutes of our time together today. All right, so let's get started on what is TRICARE and also who's eligible. So TRICARE is a comprehensive worldwide healthcare program for uniformed service members, retirees, their families, meaning their immediate families, and survivors. And it's managed by the Defense Health Agency. So the plans included in TRICARE that are under this demonstration would be TRICARE Prime, which is HMO or managed care, and TRICARE Select, which is a preferred provider option or PPO. Okay, so the TRICARE childbirth and breastfeeding demonstration allows certified labor doulas, lactation consultants, or lactation counselors, depending on your state, to provide care to eligible beneficiaries. In the TRICARE East region, the childbirth demonstration program is running and has run since January 1st of 2022, and it is set to end in December of this year. And eligible claims may be filed. Eligible claims were beginning to be filed starting April 2nd of 2022. So something that's important to note with regards to TRICARE is that as long as you are in network, which we will talk about how to get in network during today's presentation, as long as you are in network, referrals are not required. However, if one of your clientele have Prime as their TRICARE program and you are out of network, they will need a referral from their primary care manager or physician to see you. So if you are not currently a network provider, anybody who has TRICARE Prime would need a referral from their PCM or their physician to see you. TRICARE Select, that is not the case. So just confirm that with your clientele, what plan they have, and also I will show you where to confirm where you are, whether you're in network or out of network. Okay. Also, something important to note is that anybody who's giving birth at a military hospital is not eligible for this program. So if they're giving birth to where they're giving birth in a hospital that is off base, then they are more than welcome to use this program. However, clients cannot be scheduled to give birth in a military hospital and also receive this benefit. Okay. So this is the nitty gritty of it. How do you qualify for this program? So requirements to join this program would be birth doula services only. Okay, so TRICARE provides reimbursement for birth doula services. Postpartum care alone does not qualify. I think that's a very important distinction to note. You cannot use the CBDS reimbursement for postpartum care at this time. You can use some of the time for a postpartum visit, and we'll talk about that as we go along, but primary services under this program is for birth doula support only. So not fertility, not postpartum, birth doula support only, okay? Also, doulas must be certified by the National Black Doulas Association, known as the NBDA, so us here. You can also be certified through DONA, BirthWorks International, CAPA, ICEA, or TOLABOR. Or if you're not certified by any of these organizations, you could also be participating in a qualified statewide Medicaid program and still qualify for this benefit, okay? You will also need your state license number, and that's only if your state requires doulas to have a state license number. I believe Ohio has that requirement now where they're with the nursing department or the division of nursing. So if you have a state license requirement in your state, Georgia does not, but if there is one in your state, you would need that. You will also need your current BLS or CPR certification. I recommend going through the American Heart Association. It's like the gold standard for BLS certifications. The thing is that your certification cannot be expired, so it has to be current, okay? You also will need your current birth doula certificate. Okay. But when I say birth doula certificate, I mean that it needs to depict that you are a certified birth doula, not that you have completed training, but it needs to depict that you have a certification as a birth doula, and it cannot be expired. So if it is expired, please follow your processes for expiration and renewal before you submit it to join this program. Otherwise, the application will be denied. You will also need to complete and sign a participation agreement. Do not worry. I've literally put all these links together for you all in the handout that they will send out, but you will have to complete and sign a participation agreement. You also need to have an NPI number and a tax ID. So if you don't have an NPI number, while I didn't go into full detail on how to create an NPI number here, since that's not necessarily the guise of this meeting, I'm more than happy to give you the link to do it. It's very simple. It's an easy Google search. Register for an NPI number, and it will take you to the national government website. NPI, if you're unfamiliar, stands for National Provider Indicator. Okay. You will also need your tax ID information. So if you're a sole proprietor, that would be your social security number. If you have an LLC, whether single member or partnership, that would be the tax ID assigned to you when applying for your business license. So let's talk about what's so in the following way. So this demonstration
Hey, honey, I
covers
think it went out just a little bit. I'm so
uh-oh.
sorry. It went out
It's okay.
just a little bit.
Can you hear
You can
me?
just start over with this slide.
Okay.
Yep, we can hear you.
So, okay. So what's covered? This is how payments are broken down. The TRICARE program covers 6 hours of prenatal postpartum support in person. So I make that distinction because virtual doula visits are no longer eligible for this program. So it has to be done in person. So if you have an office, they can come to your office, or you go to their home, and it would need to be coded as such. And I will show you how to do that on the form. Okay. Care for doula support cannot begin until 20 weeks gestation. That is due to the guys that across states, pregnancies are not considered viable until they've reached 20 weeks. So this is something important to note. So any services provided before 20 weeks gestation, you cannot request reimbursement for the support that you've offered. Okay. Also, if you complete any postpartum visits with clients that are participating in this program, they must be completed no more than 1 week after giving birth. So it can't be an extended period. It has to be 1 week after giving birth. Otherwise, either they don't utilize those hours or reimbursed at that time. Okay. Also, in-person support for the duration of labor is covered. So there's a flat rate that is covered. I encourage everyone who does this program, charge your actual rates versus the rates of reimbursement that they offer on the website. I'm sending those over to you all as well, and it is broken down by state. Charge your actual rates so that you can be reimbursed appropriately. That's how we drive the line, and also encourage them to pay us what we're worth, especially for our time and commitment to our clientele. All right, so how to document. TRICARE is insurance, and normally speaking, doulas are not bound to HIPAA laws. However, you should have a CRM that is backed with a BAA, okay? And this is very key if your systems are to get audited for any reason. Insurance panels have audits, so you want to make sure that you are having clear documentation that shows that you are being mindful of protecting your clients' protected health information. So if you're not familiar with protected health information, or PHI is, that would be phone numbers, addresses, names, date of birth, and then also you'll be getting their DOD benefits number as well. And it's important to make sure, I'm getting some feedback. Can everybody double check that they're on mute for me, please?
We got it. You're good.
All right. Thank you. All right. So again, you want to make sure that you have a CRM that's backed with a BAA. Now, for me personally, as I expressed, I'm a clinician by trade as well. I'm a therapist. So I utilize Simple Practice. I'm also looking to transition to Alara Health to be more encompassing of this work here. But it's very important that you have this information protected in a space that is willing to give you a BAA, and has like two-factor authentication. All of those things are really crucial to make sure that you are doing your due diligence to protect your client's information. Okay. You should also be accurately documenting the days and times of services rendered. So whether that's your utilization of a calendar, you have a notes. I have an app on my work phone that is all about due dates. And whenever I meet with the clients, I type a quick note in there. And then when it's time for me to document in the system what we covered, I'm able to refer back to those notes and put it in there so that when I'm doing my claims, I can make my claims on time. Okay. You also want to keep track of the client's date of delivery, the date of admission. I didn't put this on this slide, but this is something that's important that I would encourage you to note. You want to document the date the client has been admitted to the hospital, the date you arrived to support them, and then the date that they were discharged from the hospital. Okay. And then once you enter in that information, you want to make sure that you have that for documenting it in your claim in the express claim section. Okay. So include, what I recommend doing is include questions regarding benefits number, date of birth, and sponsor information on intake forms. So you want their Department of Defense benefit number. You also want their Department of Defense ID number. You want their date of birth. So by their date of birth, I mean the client that is pregnant and giving birth. And then you want their sponsor information. So who is actually a part of this? Is it a parent? Is it their spouse? Or is it themselves that's registered with the United States Armed Services? Okay. Also, something to note is that it is important that you file your claims as soon as the service has been rendered when possible, specifically for antepartum visits or prenatal visits. So, for example, I had a prenatal visit with one of my clients who is utilizing this benefit last week. Once I finished the visit, I had my notes in my phone. I went home, completed the claim, submitted it, and I was paid out within 5 days of submitting the claim. Okay. It's another thing that's important to note is that we are not getting paid directly by these clients participating in this program. Clients should not be paying you any type of money at all with regards to getting paid for services. Payment is the sole responsibility of the doula to file the claim with TRICARE to get reimbursed for the services rendered. Okay. So I think that's very important to note, because if it is found out that you have paid any money, then you will be removed from the program. All right. So all of this background information, that is what you need to know with regards to what the program is, who can access it, and some best practice tips for navigating those processes. So now I want to walk you through the application process. Okay. So we can see it now, right?
Yeah.
Awesome. Okay. So here is the application process. So like I was saying, you will get access to the application and the form for the participation agreement. Once you check your emails, the MBDA will send that out to you. So just so you know, process, just to set clear expectation, processing takes about 30 business days. I want y'all to think Monday through Friday. So we're not including Saturday and Sunday. They are very serious about it taking 30 business days, just so you're aware. Okay. So it takes 30 business days. And then once it's been processed, they will email you the next steps. Okay. If you have not heard from anyone within 30 business days and you are TRICARE East, okay, I recommend emailing Kim at the email here. Okay. Take a screenshot of this if you need to. If you are TRICARE East, if you're TRICARE West, again, I apologize. I'm not familiar with their process or who to reach out to on that end, but I do have a group that you can join that offers support for TRICARE West. That's also in that document of resources that I sent over. But if you are TRICARE East, email Kim Chu at kchu@humanamilitary.com. Okay. But once your application is approved, you're going to receive an email from your assigned rep. So you do get an assigned TRICARE rep with onboarding guides. It's going to be full of information and things like that. I can't share that with you yet because you're not provider. I don't know who's all a provider versus who's not. But if you are a provider, they would have sent this information to you. And then you can create your Humana provider profile. And so I'm going to walk you through the process of creating that provider profile. You do not have to wait until you apply to create the provider profile, but it can cause some hiccups in the process. And I'm saying that from experience. I created my provider profile before I'd actually spoken to someone at TRICARE about the process. I think we had another one of these types of events, but they were focused on TRICARE West, and they were saying, oh, create your profile, so on and so forth. And then by the time it came to me completing the application and things of that nature, it caused a little hiccup with regards to my location and things like that. So I would wait until you've received all this information before creating a profile, but you can create it beforehand. You just will have to stay on them a little bit longer to continue to get support. All right. So in order to create your provider profile, this is for TRICARE East only. TRICARE West uses a different provider for insurance. So this is, again, for TRICARE East only. All right. So you're going to navigate to this website here, humanamilitary.com/provider. You're going to select create account. You're going to read the disclaimer and select continue. You review the user agreement. And if you would like to move forward after reviewing it, you would select I accept this agreement and select accept and continue. And then you follow the prompts on the screen to complete your online profile. Now, I didn't include screenshots because this section of this website, y'all, changes so frequently. So that's why I just gave the step-by-step, because these steps are tried and true. They are the same each time, but how they look on the screen is different. So this is exactly what it would look like. This is where you would navigate to. And please note the quotation mark behind provider. That is just to show this is the area you're to provide to. You should not add that mark behind the R. So it should just read as a regular web address without the inflections by the H and the R, just to clarify. All right, so once you're logged in, you want to navigate through the provider portal and make sure that your information is correct. So you're going to verify these following sections. And I didn't include screenshots because they include some of my personal information with regards to my NPI and business ID and all those things like that. So I didn't include screenshots of those. But again, broke down the sections so you could be able to see or conceptualize what it is that I'm describing. So we have the group information. You want to verify that your provider name should be your registered business name. Okay. So the provider name for me is Rebirth Wellness DBA Birth Fear Free. That's my business name. That's how the state recognizes it. That's what should be there for a provider name. Okay. Network status. So long as your participation agreement is signed, it should read in network. Out-of-network providers can still file claims, but remember, prime customers must receive a referral from their PCM or physician for doula services, okay? So if you were to go ahead and create a profile for TRICARE, right, you could technically already be an out-of-network provider before this participation agreement was signed. And if you wanted to go ahead and begin working before your participation agreement was received and signed, you can. But all TRICARE Prime customers must have a referral on file from their PCM, which is their primary care manager, or physician for doula services, okay? In the specialties area of group information, it should read doula. And then the specialties by support, it should read childbirth doula support, okay? Then next to that is your user profile. That's where you verify that your name, email, home address, or address of your practice and phone number are correct. If any of this information does not match your current details, that can result in denied claims in the future. So always make sure that you are keeping those things updated as you go along. All right, so this is the best part of this is filing the claim, getting your money. And again, this is the platform for TRICARE East. TriWest platform looks completely different. They use a completely different insurance payer and a completely different system. Okay, so Humana is for TRICARE East. Okay, but if you are a West provider, again, I do have a group that you can join. It is on Facebook, but it is extremely helpful and was helpful for me in a place where I got a lot of the resources that I'm going to share with you guys today. So when you're filing a claim, you're going to navigate to the claim section and select Provider Access Claim Center. You're going to verify that your provider and location match your name and business information. You then select Submit an XPC Express Claim. Then you select Enter an Express Claim Now, and then you select your NPI number. If you have a group practice, there may be multiple NPI numbers under you. So that's something to be mindful of, right? So if you have like an agency or a collective and all of your doulas are eligible for this program, you would select the NPI number related to the person that is providing the support, okay? So once you do that, now we have screenshots because I can show you these screens because they don't have a lot of information about my business on there, just my name here, which y'all know, right? So when you're submitting a claim, once you do all of those steps, this is the screen you will come to and express claim, again, for TRICARE East. So select the patient who received care at, and it should read your name and location, okay? What you're going to enter is that DOD benefit number and the patient's date of birth. So that's why I recommend if you have TRICARE clientele that you are serving, put those questions on your intake forms. Once somebody has signed a contract with you, put that information on the intake forms so that you have easy access to it for entering it into the system. And it's also documented in a safe space. I don't ever ask my clients for their social security number because the Department of Defense number works just fine, okay? And then after you put in the DOD benefits number and their date of birth, you hit submit. Then you're brought to this screen here, okay? So the information that you've already entered in or that's already in the system will pre-populate, okay? Obviously, anything with a red asterisk, you wanna make sure that you are completing. Otherwise, you cannot move forward. So the patient account number, what I've done, y'all, is I use the patient's ID number that's on the back of their Department of Defense ID. I use that. And I also ask that question on the intake form just so I have an easy access for it. Okay. You also want to make sure that you have the relationship to the sponsor, as well as verify the address that you have on file versus what automatically populates. So again, relationship to sponsor means who is the person that's in the armed services, right? And if it's not them themselves, right, which is an option under relationship to sponsor, it could be spouse, a parent, so on and so forth. Okay. Also, some things to note is that on the right side of the screen, you should see benefits assigned to provider. That should be set to yes. And then release of information, it should be selected yes. A provider has a signed statement permitting release of medical billing data related to a claim. When you signed your participation agreement, that's what you did. Okay. Then place of service. Now, this is important, y'all, because what you put here has to match what is on the next screen. So pay attention to this part. Place of service. For in-person prenatal or postpartum visits, you're either going to select option 11, which is office, or option 12, which is home. Now, when you're attending the birth, you're going to select option 21 for inpatient hospital. Okay. Then the claim type, it should read original claim unless you are making a correction. Now, when it comes to corrections, y'all, that is something that you reach out directly to your rep about, and I'm going to show you how you do that as well. Okay. Once you've completed all the information on this page, you select continue with express claim. Then you're brought to this screen. Now, when I first saw this screen, I'm not going to lie, I kind of panicked because I was like, what are y'all talking about? Because this is nothing like what I've done in my practice as a clinician. So, important thing to note, code set should be set to ICD 10. Okay. The diagnosis code, you're going to insert the ICD 10 code for birth or prenatal postpartum visit that begins with a Z, or the diagnosis codes for the actual birth, which also begins with a Z as well. Okay. Then you're going to enter the dates of the service. So from and to dates. So let's say it was a prenatal. Okay, well, I went today on the 21st and then I left on the 21st. We completed 2 hours of a prenatal. You enter that on that first line here. Okay. Note that you see there's up to 12 areas for diagnoses codes. If you are doing like batch requests for like your clientele, or let's say you like to wait until the end to request all of the payment after you've attended the birth, you can do that. You would just need to put each individual diagnosis code. My pro tip, submit it as soon as you completed the work so that you can get paid out. Okay. So then you enter the place of service. So again, that needs to match what you put on that initial form, either 11 office, 12 home, or 21 inpatient hospital. The procedure and modifiers. The procedure begins with a T, and you are only going to put it in the big box. Nothing needs to go in these small boxes here. Okay. You only put it in the big box. It begins with a T, and do not worry. That's also a part of the resource I sent you, where the diagnosis codes for the ICD-10, as well as the procedure and modifiers. So once you've moved past the procedure and modifiers, you've entered that in, then it asks the diagnoses. You are going to match the diagnoses. So if you put the diagnoses code in 1, you're going to put a 1 here. Okay. If you're talking about the diagnoses that you put in area 2, you're going to put a 2 in the first box. Okay. So on and so forth. Now the charge. I advise everyone to charge what you charge your clientele now. Now, here's a big piece of information that I think is very important to note. When you sign the participation agreement, maybe your first payout may be exactly what you put in there, right? But the next payout, you may see that it's reduced a little bit, right? And that is because when you sign the participation agreement, you're agreeing to negotiate your pricing to give a discount of service for the childbirth demonstration program. So another resource that I gave you was also the payout rates. I encourage you to charge the rates that you normally charge so that you get closer to the amount that you receive normally from your clientele. That's also how we let them know, hey, this is actually how much these services cost. Okay. So when you enter your charge, enter the amount that you would normally put. Now for the units portion, this is important. Okay. Prenatal postpartum visits, they are billed in 15-minute increments. So you would need 4 units to equal an hour for a prenatal visit. Typically speaking, my prenatal visits are 2 hours. So when I enter my charge, I enter the units as 8. Once I enter that information in, I hit continue at the bottom, and then I move on. For the birth, you enter the amount that you charge for the birth itself, and then it's only going to be 1 unit. And then you select continue and move on through the process. Now, once you've done that, I think something that's important to note, if I go back after this screen, if it is a prenatal visit, it'll say, are you sure you're ready to submit this claim? You say yes, you're good to go once you review it. If it is a birth, they're going to ask you, hey, what was the date of discharge and the actual date of admission for your client at this inpatient hospital? You want to make sure that you have those dates documented so that you can submit it. Then once you enter that information in, you submit it, and then you're done. So to check the status of your claims, you're going to navigate to these areas on the homepage of the provider portal. So be sure that you have your claims number. When you submit the claim, it's going to come up with a receipt that has the claim number and the submission and what you submitted the claim for. Okay. That only populates one time. You will not be able to access that document again. So I advise you to save it as a PDF to your computer and upload it to your client's file in your CRM system, or have it under lock and key on your computer, however you do it, right? Just making sure that you have this information saved in an area that keeps your client's PHI safe. Now to check in on your claims, again, for TRICARE East, you can navigate to these sections on the homepage of the provider portal. Be sure that you have your claim number, which will come up on that receipt, dates for which you submitted it, and the TRICARE IDs of the client that you're supporting. So this is not the benefits number, this is that ID number that I asked you to collect on the intake form that you have with your clients. So if you want to look at a claim summary to see how something's going, this is this area right here. You can search via date of service, payment date, or check number. You can enter the TRICARE ID, you can enter the claim number, and then enter the dates in which you submitted it and hit search. Okay. Same thing here for remittance. If you want to check to see, hey, when was this check paid out, or you want to see how much was I paid out for the year, they will also send you a 1099 if you make over $600, which you likely will with them. You can search dates of remittance to see all the checks that have been dispersed to you. You can also check for correspondence regarding any of your claims, right? So you put the beginning and end date that you want to check. You can also include the claim number, and then you hit search, and then it will let you know in this section here how it was communicated to you. Was it via email or letter that was in this platform here? So claims are typically paid out within 5 days. Like I said, is so long as you are registered for electronic funds transfer. So in order to make sure you're registered for EFT, you want to select under group information on the provider portal. You can select view and update EFT and ERA to set up direct deposit. Otherwise, they'll be mailing you a paper check. The first check I received was a paper check, but I set up direct deposit. It was very simple. And then I started receiving my payments immediately into my bank account for my business. Okay. If you have any concerns or need some ongoing support, there is an area of help for that. For ongoing support in this same area, you're going to navigate to this envelope here. You'll select that mail icon. You select compose a new message. When you select compose a new message, it will pop up with this screen here. This is a drop-down menu. 9 times out of 10, it's generally going to be you're selecting claims if you want to follow up on claims. Or if there's a concern about your demographics that needs to be updated, you can also select that as well. Those are typically the ones that we utilize. Okay. Then you type in your message in the little message box here. You can also upload any supporting documentation that you feel like you need specifically for claims. You select submit or send, and then you receive an email when a response is collected from your rep. It can also be accessed at any time in the provider portal. All right, so here's some common facts for TRICARE.